Representative Alexandria Ocasio-Cortez recently questioned CVO Health CEO, and what she uncovered is interesting. Imagine if the same company that sold you car insurance also owned the repair shop, they manufactured the replacement parts, and decided what those parts should cost. That's essentially what CVS does with healthcare. They own Aetna Insurance, CVS pharmacies, the middlemen who set drug prices, and even some drug manufacturers. When someone gets sick, CVS profits at every single step, from the doctor's visit all the way to filling the actual prescription. The CEO tried claiming that this benefits customers, but AOC wasn't buying it. She pointed out that when one company controls everything, they're just moving money between their own pockets, all while marking up cancer and HIV medications by over 1,000%. Imagine being a healthcare worker right now, knowing that you work for a system where profits come before patients. Or worse, imagine seeing a loved one pass away just because their insurance wouldn't approve a life-saving treatment for months. What's worse is that recent policy changes are making this crisis even more severe. At the end of 2025, enhanced insurance subsidies expired, causing premiums to skyrocket. Some people's monthly costs literally tripled overnight. Legislation passed last year is projected to strip healthcare coverage from roughly 20 million Americans. Ironically, states that actually expanded Medicaid to help their residents are getting hit the hardest by these cuts, while states that refused expansion already deal with crushing medical debt and higher death rates. Instead of fixing the broken states, we're dragging the functional ones down to match. For example, we know that it's illegal for companies to purposely raise prices on essential goods before a storm, as in they can't mark up prices for gasoline, water, generators, stuff like that before a hurricane or something. So if we know that that practice is illegal, why is it hard to understand that healthcare profiteering is the same illegal practice? The frustrating part is we already know the solution. Every other wealthy nation provides universal healthcare to their citizens, spending less money while getting better results. A Medicare for all system would remove the profit incentive from keeping people healthy. Your ability to afford insulin or chemotherapy wouldn't depend on your job or income. It would simply be guaranteed, like fire departments or public schools. Right now, healthcare is treated as something you have to earn rather than something you deserve just for being alive. If this bothers you as much as it should, please subscribe and help spread awareness about how this system actually works. The only way this changes is if enough people understand what's happening and demand better. These corporations aren't going to reform themselves. They're legally required to maximize profits, even if that means letting people die when they can't pay. We're the richest country on earth. We can afford to keep our people alive and healthy. We just have to decide that human life matters more than insurance company stock prices. Thanks for watching.